Why the scissors there?
I know it. AEDs are for emergencies. I think in case you need to cut the person's clothes.
Okay.
Yeah.
Okay. To get to the skin.
To the skin.
Okay. I understand.
Self-test. In case of emergency, press the green on-off button.
This is one. This is green, right?
Yes. Then you now put the pads.
Okay. So you can remove this now, right?
Yes. Peel and attach.
This is the pad.
Yes.
Yes, they
This
come
is the pad.
Yes.
So you have to.
Is it 2 pads?
Yeah.
Okay.
Open.
Open it now.
Okay.
Okay, this is how it is.
Yes.
Yes.
So one goes here, the other one goes
And the other
on the
chest.
chest.
Okay, this
Yes.
one goes on the chest.
Yes.
While this one goes to the side.
Yes.
Side, I think it's as if it's opposite chest. Yes.
Yes. Yeah, and here.
Yes. This is the left
Yes.
pad, right?
Yes.
This is the right one on
Yes.
top of,
Yes.
isn't it?
Yes.
Yeah, on top.
Yes, on
That's
top here.
here. Why this one comes here?
Something like this.
Okay. Then once you attach,
You
this
now.
is the shock, right? You on this one
on.
first.
Yes. So it will read if it's a shockable
Voltage.
yes, if it's something you have to apply shock. So usually, once you apply, you press. It analyzes. If a shock needs to be applied, it will tell you give
Okay.
a shock.
Okay.
So you now press. Then usually it will tell you hands off.
Okay, of course, to avoid you
Yes,
getting
to avoid
the
you
shock.
getting shot. If it's not a shockable, you will tell you to continue
And this part can be changed over time.
over time, but this should last.
And I know now,
Yes.
it looks over time it's likely to either.
Yes, so far it's taking good care of it, should last. And this is Philips brand, so it's a good one. It's common.
Do you have the parts?
We can get it if we have to.
That's the extra pad.
The extra part.
And how many do you need for the extra pad?
No, I'm just asking. It should be available now.
Okay. Yeah, we can get them.
Hold it. Let me roll it back. This. Yeah. Where is it's supposed to be up here, right?
Yes.
Okay. Good. Is it? Hand. Yeah. Good. Okay. Yeah. Back. Okay. Yeah. It's okay.
Okay. I think I advise we remove the
Yeah,
battery.
remove the
sir.
battery, yeah. So it doesn't
Yes.
put it in this pack, right?
Yes.
So the the place is supposed to be, is it supposed to be in the theater or in the emergency room?
A and E.
A and E.
Yes.
Yeah, and this is the best place.
Okay.
So if there's ICU too.
I see it. Okay, so
if
we'll put it in the A and E. Thank you. Why this window here? There's a reason why that window
they
is
would
kept
should
there.
be.
Do you understand?
Yes.
Open again, let's see. What is it actually seeing? What can you see?
The on or off button.
Okay, the on or off button.
But in case you lock it in with the
Uh,
battery, you
without,
can
yes,
remember to
okay.
take it off.
Okay.
Probably yes, maybe it will blink and you
You
realize.
know that it's on. The battery is there. It's okay.
So the manual.
The manual, yes, which we have to take a look at it.
Yes, sir.
Okay. That's it. So we will. I will. It's okay. Keep it on the floor.
All right.
Let it not fall.
Okay.
You really need to put for later.
Okay, sir.
You don't reach here now.
I know you, sir. I'll be outside, sir.
See. This
Uh-huh.
was
Oh,
there.
we almost forgot. That's what covered the
The face.